last names, Tiffany Erhardt and Snyder, and Alberta Roman, who is one of the people who's helped put this conference together. Tiffany Erhardt and Erin are both from StateWide Senior Action, and they're going to lead us on the senior landscape.
Thank you.
Hello everyone, can you hear me?
Very well.
All right. So thank you all for being the people here in your seats for the last panel of the day. You are very special to me and I'm grateful to you. Today we are loving the ones we are with. My name is Alberta Roman. I am the chair of the Exploratory Healthcare Committee of the League of Women Voters, Buffalo-Niagara, of which I'm a member. In the interest of sticking to our well-structured program, we will get right to hearing from our special guests, Tiffany Erhardt and Erin Snyder from the StateWide Senior Action Council. Statewide. Take it away, Tiffany.
Thank you. Yes, thank you guys for being here today. This is something that we're very passionate about at StateWide. And today we're going to be focusing on long-term care and how that affects seniors in our area, but also across the state of New York. And so as I say that, you can also understand the breadth that this isn't just happening in New York, but all across the country. These barriers are not isolated to us. So, okay. New York Statewide Senior Action Council is a grassroots nonprofit organization. We are made up of and governed by seniors all across New York State. We have 3 helplines. The first is a patient's rights helpline, so being in an inpatient facility, hospital, skilled nursing facility, dealing with those denials, early discharges, stopping services that need to continue. We help individuals navigate those, but also understand their rights. All the counselors at Statewide are MCAP counselors. We partner directly with Office for the Aging to be able to give unbiased insurance counseling to Medicare beneficiaries. And then finally, we are the grantee for the New York Senior Medicare Patrol, which is about fraud prevention and detection with Medicare and Medicaid. That's my program. I'm the director of that program for New York State. So when we're thinking about the long-term care crisis, we really need to address the affordability, the accessibility, and the systematic improvements of our current systems. We know that it's broken, especially if you've been sitting with us all day today. This is really what we've been talking about all day. It's broken. We need to enact change. So what we're really going to focus on today is the long-term care aspect. So for the majority, this impacts seniors, but it's not just seniors. There are individuals under 65 who need long-term care. So understanding what long-term care is a very big component. So this could be custodial care, among other things. It's essentially the care provided by an aide to assist with what clinicians or doctors will call ADLs. So ADLs are activities of daily living. These are the first 5 things that you do when you wake up in the morning. You're sitting up on your own. You're gonna ambulate, you're gonna walk to the bathroom, toileting, transport from a chair or a bed, brushing your teeth, feeding yourself. These are activities of daily living. Somebody who needs assistance with these needs an aid. This is what we're talking about for long-term care. And accessibility to this is not easy. Pending a person's needs, it could be intermittent or long-term. It can be given in a facility, like a skilled nursing facility, a hospital, depending on the situation, or in the community, like an adult day center, or in the person's home. So we have a lot of acronyms. We love our acronyms. LTSS is long-term services and supports. So we're thinking about critical to disabled older adults needing assistance with their ADLs, those activities of daily living, or IADLs, instrumental activities of daily living. So that could be other things like cooking, cleaning, preparation of meals, laundry, calling and, transportation to doctor's appointments, scheduling, things like that. LTC, long-term care. HCBS, home and community-based services. So whether this individual receives the care that they need in a community setting, like a skilled nursing facility or adult daycare, there are a lot of medical model adult daycares around that offer various things, but the accessibility to that, there are barriers. Things like transportation and affordability. A lot of times when we think about long-term care, somebody has to be a Medicaid recipient in order to access that. In 2020, there's an estimated $5.8 million used in long-term services and supports in the home and community settings, and $1.9 million used in long-term services and supports in institutional settings. Long-term services and supports, LTSS, they can be extremely expensive. And something that I'm going to say multiple times is long-term care is not covered by Medicare. Okay? People don't often understand that Medicare doesn't cover this. We'll talk about Medicare coverage, the little components of it that it does, but as a general rule, long-term care is not covered by Medicare. Individuals over 65 needing help with more than 2 activities of daily living is approximately 57%. That's over half of our seniors. Needing long-term services and supports, 56%. Utilizing a nursing home after 65, 39%. When we think about long-term care, it's not necessarily medical care. When we think about somebody being in a skilled nursing facility, that is skilled care. Needing physical therapy, occupational therapy, speech therapies, because they're working on gaining that mobility, they're working on, mending a broken bone, recovering from a fall. Long-term care is assisting with things that we do every day. It's not a sort of rehab. It's doing our daily life. I have it up there. I'm not a screen reader, so I'm not saying the things that are up there, but I hope y'all are flowing with my drag here. I'm candid. I'm just gonna keep going. So what do New Yorkers want? And I know you guys know this because you've been with us since 10 a.m., okay? 50 or older, we prefer to receive long-term care at home. We don't want to be in a facility. We spent all of our lives working hard. We want to be in the home that we bought. We want to be in the home that we lived in. We want to be in the home that we built. That's where our families are. We want to be in a facility. It's cheaper to be at home. We want to be home. And right now, that is very hard to access. Women need care longer than men, 3.7 years versus 2.2 years. There's a link for a source, but it's embedded. If anybody wants that, they can ask me afterwards and I can obtain it. 1/3 of today's 65-year-olds may never need long-term care support, but 20% will need it for longer than 5 years. Someone turning 65 today has almost a 70% chance of needing some form of long-term care service. So, various ways where we can obtain the care that's needed. Medicare.gov is a really great resource. could be provided by somebody that you know, if they have Medicaid. A family, friend, caregiver, neighbor, somebody that you know, through a home care agency. That's where they would be paid through. Adult day service programs is another way to obtain that. In a nursing facility or assisted living facility. Different ways that somebody can obtain that care. The cost of services for long-term care is extremely expensive. For a private room in a nursing home in 2021, the median annual cost was approximately $108,000 a year. $54,000 for an assisted living facility, and $61,000 for a in-home health aid. This was median cost across the United States. How are these services paid for right now? Primarily Medicaid. So Medicaid is coverage for low-income individuals. When we think about Medicare, Medicare Part A can pay for some home care. If it's home care, there's very specific criteria. It has to follow a hospital stay. It's short-term, and the individual needs skilled care. So when I mention skilled care, that's receiving physical, occupational, speech therapies in order to, it's like a rehab type thing, and it is short-term. There are a limited number of days, and it's very contingent. Other ways to obtain home care services or long-term care, is the ISEP program through Office of the Aging. This is a fantastic program, but it has a significant wait time. There's a line. My grandfather died in line. The Veterans Administration, that's another way to obtain assistance. Office for Persons with Developmental Disabilities. If somebody has long-term care insurance, that's something that can be utilized. Or out of pocket, if you have cash. Medicaid does cover long-term care. There is an income and asset eligibility. Sometimes people can do a spend down if they're over income. They can spend down to be eligible on a monthly basis to be able to access the care. Or prior, individuals can do estate planning. They can do a pool trust. That can be costly, and you want to make sure that you do that 5 years before that that Medicaid application, because there's a 60-month look back for long-term Medicaid, skilled nursing facility Medicaid. So managed long-term care is a delivery of long-term care services. It could be in an adult daycare, or it could be at home and it's screened through the New York State Department of Health. There are mandatory enrollments for that. If somebody is dual eligible, so they have Medicare and Medicaid, over 21 years of age, and they need community-based long-term care more than 120 days. So as I was doing this, I actually got to learn that, because I did not know those rules with MLTCs that manage long-term care plans. Medicaid income and asset limits. So these are the updated numbers for 2024. For somebody who is eligible or enrolled in Medicaid, somebody who is eligible or enrolled in Medicare has an asset and income limit. Under 65 and not enrolled in Medicare, it's the same income limit, but there is no asset test. So assets are money in the bank, stocks, bonds, if you own multiple properties, homes. It limits the ability for seniors or older individuals to be able to access Medicaid. There are a variety of barriers to accessing long-term care. There's under or uninsured. I've heard 5% all day. 5% of New Yorkers are uninsured. It depends on who you're talking to. Some will say, it's only 5%. And others will tell you, it's 5%. We're leaving them behind. It's a barrier. We have people walking around every single day who do not have access to care. They prolong accessing healthcare because of the cost. This is a very real thing that happens every day. Coverage is confusing. There's networks, covered services, prior authorizations, coordination of benefits. It is very hard to maneuver through. As a person who has spent their entire career navigating the healthcare system, I've been able to be a pro at it because that's what I've done for the last 10 years. And it's not easy. The home care shortage must be addressed. And with the New York Health Act, this can happen. People who need care are waiting at home in dangerous situations by themselves, at risk. This is happening every day. Understaffing has a cost, and it may be a cost of doing business, and that cost is too high to pay. People are dying. Older patients very often experience long-term consequences from preventable infections, falls, bed sores, and other things, just like it. People come out of facilities in worse care, in worse state than what they went in. They were supposed to go there to heal. $315,000. How much money a typical couple retiring this year at age 65 will pay out of pocket for health care over the rest of their lives? $315,000. That's without considering any long-term care. That's not long-term care included. $5,600 is what CMS estimates Medicare enrollees will pay out of pocket in 2019. $5,600. In 2019, that was a minute ago. The cost of living is way higher now. Long-term care, vision, dental, and hearing are not covered by Medicare. Those are the things that we need as we age. New York needs to prioritize programs and services to allow people to maintain in their homes, or at least a continuum of care. Expand funding for the ISEP program, eliminate the barriers to home care services, and budget for the fair pay for the home care to adopt the New York Health Act. This is an image of our current healthcare system and the way an individual has to navigate it with referrals, and prior authorizations, and denials, and appeals, and networks, and all the phone calls that it takes just to get access to service if the person has the tenacity to go through it. And we know that we can do better. With no out-of-pocket costs, no co-pays, deductibles, no Medicare premiums, no closed networks, absolutely coverage when you travel out of state, and long-term care included. It just makes sense. So, I want to thank you for listening to me. This is the part where we're going to break it out and we can ask and answer questions. Erin and I are here from StateWide, so we can answer any questions that you have relating to our long-term care subject. And if we go off topic, I'm going to do my best to answer it anyway.
We have one out here.
Yes, sir.